Ontario is on track to lose thousands of nurses and hospital beds by 2028, with many local politicians calling this a disaster. A new report shows that the government is only planning on increasing healthcare funding by 0.7% annually for the next 3 years. For reference, over the last few years, inflation has been around 2%, 2.4%, and 3.9%, with inflation over the next 3 years projected to be hovering around 2%, which means that with a 0.7% funding increase, we are actually seeing a decrease in spending on average of 1.3%. If funding increases don't keep up with inflation, that actually means a cut to overall services. That's just how funding works. And in a normal average year, inflation usually hovers around 2%. That is usually the goal the government sets. And because of the discrepancy between Ford's increase in healthcare funding and the inflation rate, Ontario is expected to lose about 2,500 hospital beds, 7,200 nurses, and 1,800 personal support workers over the next 3 years. It's also expected that long-term care beds are also going to not come close to meeting demand, with the number of beds dropping to 56 per 100,000 aged over 75 compared to 60 as of March 31st. An example in the Hamilton Health Services that on December 2nd of 2025, 85 patients were receiving care in beds that were not funded by the province, and this would be in unconventional spaces like sunrooms, staff rooms, closets, and hallways. The report also highlights that the amount of hospital beds per 100,000 Ontarians will go down from 220 this year to 203 by 2028. And as it already stands, Ontario has the second lowest number of hospital beds per capita in the entire country. And that doesn't even get into the nursing shortage, where hospitals are paying millions of dollars every year to private companies to get staff. And you can't cut dozens of positions without affecting services. What do you think of this? Leave your thoughts in the comments down below.